Oh, the shirt is like way too much business or way too much pleasure. I'll go business today, all right? Hey, it's Mike here, and today a new study that looked at COVID severity by diet category, and I'm gonna be honest, the results here even shocked me. It looked at plant-based diets, normal diets, and even low-carb diets, so this is going to be extra interesting. We're going to talk briefly about why these different diets might have different effects, and finally, we're going to do a loose estimate of how many lives perhaps could have been saved with widespread adoption of the best diet from this study. All right, let's get into it. I will say I've been cautiously speculating about diet and COVID outcomes over the course of several videos, just waiting for a study like this to come out, and it has finally come out. And also, I know everybody is super tired of hearing about COVID. We're all sort of emotionally fatigued on the topic and want to just move past it. But it's important to learn from what happened so we can know the enemy and do better next time. And whether we like it or not, it's still going on really hard in a lot of countries and a lot of areas. And we also have new strains to potentially worry about. So this is really relevant stuff. Let's just get right to the study, which is this one from the British Medical Journal's Nutrition, Prevention, and Health Journal. It looked at nearly 3,000 healthcare workers, really frontline workers who would be exposed to COVID, and the study says, quote, "Our study has several strengths, including large sample size, diverse healthcare workers from multiple countries, and careful adjustment of potential confounding factors." Yes, they say that the diet recall of healthcare workers is going to be better than your average person, and they looked at healthcare workers across 6 countries, including France, Germany, Italy, Spain, UK, and the USA. And they're really looking at a main cutoff here. Were people having mild cases of COVID that wouldn't really affect their life that much, or moderate to severe cases, which would clearly affect somebody's life a lot and be, of course, an increased risk for death? You can pause to read all 5 severities of COVID here, but the point is they've broken that up into 2 groups. All right, now for the diet categories, of which there is 4, we have the plant-based diet category, the pescatarian/fish category, the baseline category, and then low-carb diets. And I will say right off the bat, plant-based is a loose term, as many of us already know. It does not mean vegan, and in this case, like in many cases, they've chosen to mix in some animal foods there. In this case, it combines people eating a, quote, whole food plant-based diet, probably anybody that's vegan, even though the word doesn't appear in the study, and then also vegetarians. Saying all this to say, we don't know how many vegans there actually were in the study. If I had to guess based off thin air, it's probably somewhere between a third and half of the plant-based group, but I really don't know. And then to muddy it even more, the pescatarian category isn't just people that are pescatarian. It's that plant-based group with then 40 pescatarian people added just to see if there would be a difference. So 250 people in the plant-based group, 290 people in the pescatarian group. Kind of interesting. Anyway, let's get to those results. The plant-based diet group had, get this, 73% lower odds of having moderate to severe COVID than that baseline meat-eating group, and that is ridiculously huge. The implications of that are absolutely massive, and some people are probably already going to, oh, they're probably just healthier. We're going to get to the confounding factors, other lifestyle factors that they adjusted for in a little bit, but I also need to mention here that that plant-based plus pescatarian group had 59% lower odds. I would love to have seen what those straight up 40 pescatarian people would have gotten, because they only made up 16% of that plant-based plus pescatarian group, and they kind of soiled it a little bit, because again, just 40 people moved that 14 points worse. And I would go further here and say that their data do not actually support this main claim here about pescatarian diets, that they are included in healthy dietary patterns which may be considered for protection against severe COVID-19, just by looking at their data. If I were to add 40 people from the baseline group with 1.0 risk to the 250 people from the plant-based group in the same way that they did with the pescatarian group, I actually would have a 63% lower risk versus the 59% lower for the pescatarian group. It's unadjusted, but still, their data do not support their conclusion. I feel like you could have just added 40 donut diet people and gotten the same results. Now for that low-carb diet, which of course the standard low-carb diet is higher meat, well, the results, like the literature tends to find, was not good. We're talking about a 47 to 49% increase in the odds of that moderate to severe COVID, depending on the model that they use. We'll talk about the different models in a bit. But the point is, really not looking good. However, it is worth mentioning that wasn't statistically significantly different from the baseline. Remember, forest plots, if that confidence interval, that range overlaps with the baseline, then you can't confidently say that it was statistically significantly different. However, one thing that was statistically significantly different was the plant-based versus low carb, and it was nearly 4 times as high, which is very compelling. 4 times the amount of bad cases of COVID, and this is right in line with the meta-analyses we see on just all-cause mortality in low-carb diets. It's usually around 30% higher, unless it's a plant-based lower-carb diet, in which case we can see a dip in mortality. Worth mentioning, it's mostly the meat, not necessarily the macronutrient ratio. But taken all together, we're seeing a clear spectrum of the more animal products you are eating, the worse off the COVID cases are, and this hints at part of the reason why the US might have done a little bit worse than other countries. Obviously, there's, how the public health organizations are dealing with things, so many factors. But, the US is in the top 20 of deaths per capita for COVID, and this could have played a role. I'll leave it at that. It was the meat. But why not look a little bit closer and ask that question, which is, pretty much the question of life. Why were the results so different? I previously did a video that not very many people cared to watch on meat and pneumonia, a study that came out in 2021 about how higher meat consumption was associated with pretty significant increase in pneumonia. Even the main study at hand here has under number 3 the moderate case definition, including imaging of pneumonia. This is a huge part of it. It's a respiratory disease. The main connection here is likely meat and inflammation, and I've gone into various compounds in meat that lead to inflammation. We don't need to get into that here, but I just love the way they put it in this study. Quote, "Studies have hypothesized that an unhealthy dietary pattern, such as Western diets, which are high in refined sugars, processed food, and red and processed meats, can be pro-inflammatory and have negative health impacts." Studies say unhealthy food is unhealthy. No crap. And even they point to the sugar issue there. And I know a lot of people just want to say the Western diet's only issue is sugar, it's not meat. Well, clearly looking from the low carb people, the people who are eating the least amount of sugar of anyone, they were the worst off. Not saying refined sugar is healthy or is helping anybody here. On a more enlightened note, they say, quote, "Plant-based diets are rich in nutrients, especially phytochemicals, polyphenols, carotenoids, vitamins, and minerals, all of which are important for a healthy immune system." Now it's time to extrapolate. If we were to guess how much of an effect a plant-based diet adopted nationally across all of these countries would have, it's not that hard of a calculation to do really roughly. Sorry, math nerds, I know you generally don't like it rough when it comes to your numbers. The bedroom is another scenario. I'm just joking around. The point here is these 6 countries make up about 20% of the global deaths here. Not super fun stuff to talk about, but here is our total. It's 780,000. So if people were to have retroactively adopted a plant-based diet early enough to make a difference here, we are talking about a 73% decrease in that, landing us at 570,000 lives saved, which is pretty insane. Of course, you'd have to subtract people that were already plant-based in that population, but yeah, and to extrapolate even harder, we basically have to multiply that by 5 because we're talking about a fifth of the deaths. However, a lot of other countries like India are way more vegetarian, so we don't really know. But if you were to just do that linearly, we're talking about preventing 2.75 out of 3.8 million deaths. I would say if you were to be super conservative here, a plant-based diet adoption globally probably would have saved well over 1 million deaths. To be super duper conservative, safe area. That's how I feel about these numbers, even though numbers don't care about that. The final thing that I know people are probably curious about is confounding factors, different lifestyle factors that could have also had effects, and they had 3 models to adjust for that over different severities of adjustment. And here they are. Model 1 is pretty simple. It's just age, sex, race, ethnicity, country. And model 2 is adding things like the medical specialty of the healthcare professionals, smoking status, and physical activity. And those are 2 huge ones. Because the notion here is, people who are on a plant-based diet probably exercise more. That's probably really what's making the difference. They smoke less. Adjusting for those 2 things is actually the model that is in the abstract, that 73% lower risk. Then Model 3 actually goes even further, adds on to that with BMI as well as pre-existing medical conditions like high cholesterol and high blood pressure and all of these things, which, to be completely honest, have been causally linked to be lowered on a plant-based diet. So they probably didn't adjust for them properly, but at the same time, none of the numbers change that much. So there you go. However, I do think there was a slight possibility for over-adjusting in the low-carb area. If you're just looking at the data, the moderate to severe cases when comparing low-carb to plant-based were, get this, 7.5 times higher. Maybe it was legitimate adjusting. Maybe they over-adjusted for things like exercise because people on a low-carb diet don't have any energy to do anything like exercise. Anyway, in the end, we are seeing a clear spectrum. More plants that are eaten, the more protection we have against COVID that is severe. And of course, you need to have severe COVID to end up passing away from COVID. And not to say that people who are on a plant-based diet or vegan diet are going to be invincible or anything like that. We don't need to get too cocky here, but we have a strong case now from this study that eating a plant-based diet in general, even pretty loosely, has a dramatic effect in lowering the death. I would love to see where vegans would particularly land, but as for now, they're just part of that group that is doing amazing. But most importantly here, I am not hearing about this much beyond things like plant-based news, but this should be front page news on all of the mainstream media. This is one of the main tools, especially something that can be done individually to lower risk when this pandemic feels like it's starting to end, but is not over yet, especially in different places of the world. So this should be shouted from the rooftops. So feel free to share this video. I usually don't ask people to share my videos, but this case is different. Anyway, feel free to like and subscribe. Let me know down below what you think about all of this, and I will see you in the next one. Thanks for watching.